Hello, my name is Hannah Vanek, and today I will be presenting on sexually transmitted infection prevention for African American adolescents and reviewing how different behavioral theories can be utilized in the creation and implementation of promotion programs. First, I will be talking about what a sexually transmitted infection is and how African American youth are most at risk in contracting an infection. Next, I will present different interventions that have been used and how each has been applied to this population. Finally, I will propose an intervention for this health behavior applying the appropriate theories. The health issue I chose for my project was sexually transmitted infections amongst African American children. The specific behavior I concerned myself of was that of condom usage. According to the CDC, the use of a condom during sexual activity has been found to be the most successful prevention method for STI contraction outside of the method of abstinence. Youth in general have been classified as those who are most likely to take part in risky sexual encounters that many times result in unplanned pregnancies and/or sexually transmitted infections. African American adolescents in particular, along with other individuals belonging to minority groups, are even more likely to engage in such behavior due to economic status and overall mistrust of healthcare system and a disproportionality of healthcare resources, according to the CDC. In 2018, 14% of the population in the United States was made up of African American youths 13 years and younger. Of the 645 total accounts of HIV infections in children in the United States, 61% were African American. This trend of population proportion to infection rate continues across different types of sexually transmitted infections besides HIV, such as chlamydia, syphilis, and gonorrhea, to name a few. Factors that can contribute to this disparity may include economic status, access to healthcare, along with educational opportunities. In 2017, 22.9% of African Americans were living at the poverty level. 10% of African Americans were uninsured, and African Americans in general had a recorded lower life expectancy due to factors such as heart disease, stroke, cancer, and HIV, according to the U.S. Department of Health and Human Services Office of Minority Health. African American adolescents are not only at high risk because of contracting an STI because of their ethnicity, but also because of their age and susceptibility to their peers. Another barrier to the use of condoms during sexual activity is access to condoms and the proper education regarding their use. Each of these contributing factors have resulted in the population being at high risk in contracting a sexually transmitted infection. One intervention that was started in 2009 was Focus on Youth. This intervention targeted African Americans between ages of 12 and 15. This intervention was based on the social cognitive theory. The critical elements of the theory were addressed by providing opportunities to consider the personal and social rewards of engaging in sexual risk behaviors, examining the health risks involved in unprotected sexual encounters, and identifying the alternatives to risky sexual behavior. This 8-week session utilized naturally occurring friendships between small groups of participants. A study done to evaluate this program's effectiveness took 76 naturally formed peer groups consisting of 383 African American youths randomly assigned to receive the Focus on Kids intervention or a control condition. The control condition consisted of 8 sessions which provided facts about HIV and AIDS prevention, but did not emphasize skills development with regards to negotiation, communication, or condom use, and was not delivered to the naturally occurring groups of friends. After the sessions were completed, participants were given a survey regarding intentions to use condoms and perceived risk of STIs. The first questionnaire given directly after the sessions did not show a difference between the two groups. After 6 months, those who had perceived the Focus on Kids intervention perceived greater use of condoms, greater intention to use condoms, and greater perceived peer usage of condoms than those in the control group. A second intervention that has been used is Color It Real. Color It Real was developed by the Holistic Stress Control Institute, Incorporated, for African American young adults aged 8 to 24. This program included 7 two-hour HIV/substance use prevention sessions, peer education, life skills development, and counseling, as well as treatment resources. In small groups, participants discussed the following topics: HIV and STI risk, knowledge, assessing personal risk and avoiding sexual risk, the correct use of male and female condoms, identifying and managing triggers for unsafe sex, substance use, and problem solving. This program was based on the theory of change model, the health belief model, and the self-efficacy model. A study was done to show the effects and limitations of programs and showed that those who received the coeducation program, with those around their own age and experience level, were more likely to use or intend to use condoms during sexual encounters than compared with those who were in a single-gendered program with those in different ages. Overall, this program was successful in changing the behaviors in adolescents and showed, after this program, self-efficacy and perceived risk increased, and the probability of risky sexual behaviors decreased. My proposed intervention for the use of condoms during sexual activity of African American adolescents has two main components that are very similar to the current interventions mentioned before. First, the intervention must take into account the African American community as a whole. The African American culture is very family-oriented, and a strong sense of community is a strong motif. Interventions must involve most, if not all, of the community. Parents, guardians, and other caregivers must play a part in their educational component of this intervention to their child. The social cognitive theory and the theory of planned behavior and the health belief model would be most effective in creating this intervention. Using the constructs of observational learning, reinforcement, and self-efficacy from the social cognitive theory, attitudes, behavioral intention, social norms, perceived control from the theory of planned behavior, and perceived severity, self-efficacy, and perceived susceptibility from the health belief model should be the focus. Peer influence plays a large part in the behaviors of adolescents, not only in the African American community. The proposed program works on not making change on an individual level, but on an interpersonal and community level. Multiple studies mentioned in my research stress that a child and the teen's likelihood of having safe sexual encounters depends on the impression of their peers' behavior. An effective program for this specific population involves both peers and family to change both the individual and community's condom use behaviors. In summary, African American youth are at high risk of contracting an STI due to unsafe sexual encounters. The best practice to adopt to mitigate the prevalence of an STI is the proper use of a condom. Interventions must involve the family and community to be effective. Peers are an important part and must be reached in order to change behavior in adolescents. Using the social cognitive theory and theory of planned behavior, a program can be developed to limit the infection rate in this population. This concludes my presentation on the promotion of condom usage in African American adolescents to prevent sexually transmitted infections. Thank you for watching.